Hi, I'm Kaitlin Dreiling, and I am from Magnificat High School, and I will be graduating next year, 2012. And I am a part of the Science Internship Program for Nursing, and I worked at Fairview Hospital in the Pediatrics Unit. Today I'm going to be talking about the treatment options for the pediatric cellulitis in community-based hospitals. The purpose of my research is to compare two treatment options for cellulitis in the pediatric patients: incision and drainage surgery and IV antibiotic therapy. I looked at these and determined which option leads to a shorter length of time spent in a community-based hospital. Cellulitis is just an infection of the skin or in the soft tissue, usually the dermis layer of the skin. It is caused by Streptococcus or Staphylococcus aureus. The bacteria usually enters the body through a break in the skin, such as a scrape, puncture wound, animal bites, or surgical wounds. And in the hospital, the cellulitis can be treated surgically, or it can be treated through antibiotics, depending on the location, diagnostic of the cellulitis, or of the physical condition of the pediatric patient. For the first treatment option, the incision and drainage surgery, it is usually operated on a patient who has an abscess or a highly serious case of cellulitis, which is determined by the pediatric physician. An abscess is an infected cavity of soft tissue where the skin is infected with neutrophils, which is a type of white blood cell that cannot fight an infection. So it forms a pus-filled cavity that can be drained through a small incision in the lining of the abscess. Then a drain is inserted, such as gauze or a Bessie loop drainage tube, to allow the discharge to exit the body. The second treatment option is IV antibiotic therapy, which is intravenously given through the body. And 90% of the cases are cured after 7 to 10 days of this treatment, and the skin may or may not return to the previous condition, and this will have redness or tenderness followed with it. So my hypothesis for the project was, when comparing the treatment options for cellulitis, an incision and drainage procedure is the most effective option in regards to the length of stay in a community-based hospital. The average length of stay at the hospital for a pediatric patient who has undergone surgery will be less than the average length of the stay for the pediatric patient who receives IV antibiotic therapy. I went through my process of proving my hypothesis by evaluating pediatric patients who are diagnosed with cellulitis at Fairview Hospital. I reviewed each patient's history, the treatment option they underwent, either surgery or IV antibiotics, and their total length of stay with their medications and the location of their cellulitis. I recorded their data in organized charts and looked at specifically at the time each patient spent and calculated a total average of days spent at the hospital. After observing the different cases, I then went into the question, on average, does a treatment option of IV antibiotic therapy lead to a longer stay, or is the incision and drainage procedure longer? Success was seen when children went to surgery have a shorter length of stay at the hospital, and failure was seen when surgical patients have a longer length of stay than patients receiving the antibiotics. The patient criteria was the patient must be under the age of 18 and diagnosed between June 12, 2011 and July 13, 2011. The patient was excluded if they were transferred to another facility in the Cleveland Clinic. The patient turnout was 17 females and 10 males, and over half of the patients were between the ages of 0 and 3 years of age. 17 of the patients were sent to incision and drainage surgery, and 10 of the patients received antibiotic therapy alone. This is an organized chart that I have presented, and as you can see, the number of pre-op days, there was majority of at least one day for the stay before they went to surgery, leading to a total length of stay that was longer than the IV. antibiotic patients. Most of the cellulitis was seen in dark, moist areas such as the groin or the buttock, and 12 of these patients were female, whereas 5 of them were male. For the IV antibiotic patients, there was an outlier of 4 days, and the rest ranged from 1 to 2 days. They were from 0 to 17 years old, and half of them were male and half of them were female. The average length of stay for a pediatric patient who had incision and drainage surgery was 2.118 days, whereas the average length of stay for the pediatric patient with IV antibiotic therapy was 1.700 days. As you can see, the black line, which represents IV antibiotic therapy, was a shorter length of stay than the incision and drainage surgery, which was represented by the blue line. In result, the data collection proved that the patients who underwent incision and drainage surgery had a longer length of stay than those who received IV antibiotic therapy. The original hypothesis was proven incorrect. In conclusion, surgery does not lead to a shorter length of stay than IV antibiotic therapy, but there are multiple variables that could have affected it, such as age, proving younger kids go to incision and drainage surgery, gender, degree of infection, and the availability of surgeons. For future recommendations, I have that there should be a study of larger group of pediatric patients who need to be treated for cellulitis, who have a greater focus on impacting factors such as age, gender, availability of surgeons, and degree of infections, and to share the data with future people to educate the community on cellulitis treatment options. And I would like to thank my mentor, Maria Barca, co-mentor, Joan Presh, and all those who have helped me through my experience at Fairview Hospital. Thanks to the Office of Civic Education Initiatives.